Hi, Luis. Thanks for being on the interview today.
Hi, Eric.
I'm really interested to know why you would become an investor in the Heal clinics.
Sure. Well, I learned about Heal Clinic almost 2 years ago through a friend of mine in South Carolina that had heard of your clinic. And with your expertise and your history of doing great things in the clinic, it seemed like a model that could be implemented at other places and was badly needed. The problems that we're seeing with obesity and diabetes are incredibly difficult, and there are patients every day who just don't know how to manage that from a dietary perspective, and they're really not getting enough help in their own clinics. And so I think that the Heal Care model is an opportunity for these people to be seen outside of their primary care doctor's office and get the attention that they need. And I do feel that dietary maneuvers are certainly the easiest and best way to manage this disease that we're seeing rather than, for instance, surgical options. So knowing that I'm not a fan of surgical options for people, I really feel that this methodology will be very helpful in the future.
Great. Now you're a doctor yourself.
Yes, I'm an oncologist, so I see these patients every day that need help, and they inquire about it, and we discuss very cursory ways of implementing dietary change, but it's not enough time in the office for that. And I think a lot of people are frustrated by the lack of guidance that they can get from busy doctors who don't do this full time. And so a clinic dedicated to this type of thing, using a low carb approach, which I think is excellent, drew my interest into investing in it.
Fantastic. If you were like me, I got no nutrition or weight loss training in medical school or even internal medicine residency. So it seems to me doctors don't have the tools, and I've kind of given up on the top-down mainstream approach, which is another reason to become involved at the grassroots level in a program like this. Did you get any training in weight loss or nutrition?
Not in weight loss specifically, in nutrition, a little bit like everybody else did. And, we're trained more on managing a disease medically without nutrition. And I think that that's a mistake. And then doctors that are getting interested in it really have to pursue additional study and additional work on it on their own, because there's not a lot of resources within the medical school itself. So I've learned along the way, which I think every doctor can. But again, it's not my subspecialty, and I think that many of these people with metabolic diseases need more specialized help that really a Heal Care clinic can provide. And supervision is important. You see people that have tried years after years and they're not getting anywhere, and this is really because they lack proper guidance. And so a weight loss clinic that's non-surgical can really be very helpful to have a coach, to have resources for meal planning. Those little things make a huge difference, and I think that's more of what we need.
Some people may think of this as a Kickstarter or fundraising, but this is actually buying stock in the company. So, this online public offering that's going on allows you to shape the future, and then when the company does well, you actually benefit from that too. So, was that clear to you at first?
Yes. Yes. No, I knew it was a shareholder. It wasn't just kind of getting things going and saying goodbye. So I like the model that way as an investment. And so you have two things here for me. I believe in the model itself and the medical practice that can be improved. And then I believe that the shareholders could be rewarded because this is definitely an epidemic, and the need is there. The growth potential is big, and I think that shareholders could be rewarded for participating for sure.
Well, now getting back to your primary specialty, we're watching the keto cancer research with great interest, and who knows, maybe 5 years from now, we'll be using the Heal Care clinics for treating oncology patients too. That'd be pretty cool.
Certainly, we know that there's a connection between obesity and risk for cancers, and so that's one big place to start. And in terms of the therapeutics, you're right, there's research that's ongoing that could be very interesting in the years to come, and there may be a partnership there that's necessary to manage these patients long term.
Thank you so much for sharing your thoughts today. Appreciate it.
Oh, your work. You're welcome, Dr. Westman. Appreciate it.
Bye-bye.
Bye-bye.